Amy Hendel. Welcome to Doctors on Call, the medical show that lets you call in your health questions to a panel of medical experts. Now, each week we offer you a new medical topic and a new group of experts to answer your questions. Remember, we are not a substitute for direct medical care. Now, today we're talking about the cold, the flu, and you. And my panel of experts includes Dr. Lawrence Simon, who specializes in family practice medicine at Loma Linda University Medical Center, and Dr. Conrad Salinas, who is an emergency room physician at St. Bernardine Medical Center in San Bernardino. Welcome to the show. Now, I must confess, it seems that every time this season rolls around, we notice that they can get the man on the moon, but they can't seem to figure out the cure to the common cold. Dr. Salinas, I'm curious, what do you think is the problem with finding some kind of cure or vaccination for the cold?
Well, the problem with the ordinary cough and cold is usually a virus, and as we all know, there's hundreds, thousands of viruses out there. To come up with a vaccine for each specific virus, it would be a monumental task. You're looking at, like I said, 100,000 types of vaccines that you have to give just to prevent a cold, which is, well, most of the time, very benign.
So, once again, this time of year, Dr. Simon, you must have hundreds of patients come in convinced that they're dying from some dreaded disease or convinced that their cold has turned into some horrifying disease when in fact it's just running its natural course. Do most patients request antibiotics or symptomatic relief?
A lot of patients request antibiotics, and I think it's because they do not realize that they have a virus and that antibiotics don't work for viruses. And what we try and do is educate them about the common cold, and that the common cold is a virus and won't need an antibiotic. Now, if they're sick for a very long time, let's say they're coughing for over 3 weeks, or if they have a prolonged high fever, then they may have something else that does require an antibiotic. It may not be the cold, it may not be the flu, and that's when they should seek medical attention.
Look for medical attention to reconfirm that it's something simple and not something that's really progressing to a far worse situation. Okay, we have our first caller, Victoria from San Bernardino. Go ahead, Victoria.
Hi, I'd like to know, is it fact or myth that when you get the flu shot, does it actually give you the flu symptoms so you don't get the flu later?
Okay, Dr. Salinas, let me follow that up with a second part to that question. When you get the flu shot, do most people get symptoms from that flu shot? And also, when does protection begin once you've gotten the flu shot?
Well, some people, after getting a flu shot, will experience some symptoms, but not a full-blown case of flu. They'll have maybe a little malaise, maybe a little temperature, maybe some body aches, but they don't get a full-blown symptoms of the flu. So the second part of your question was...
Protection, once you get the shot, when does it come into play?
Oh, usually about 2 to 3 weeks you start building up your immunity. That's more Dr. Simon's field than mine.
It does take several weeks, and that's why we recommend people get their flu shots, depending upon how much at risk they are, a number of weeks before flu season starts. So we recommend that people at highest risk get their flu shots in October.
So that they're pretty much covered once the real flu comes into play.
That's correct.
Okay.
And then the Centers for Disease Control, when the vaccine has a shortage, has determined that everybody else can get them in November. But if you're at high risk, then you should get your flu shot earlier, such as if you're over age 65, have a concomitant illness, heart failure, diabetes, asthma, you should be getting that shot in October so that it has several weeks to take effect. Because if you wait beyond November, you're right in the thick of flu season, and you may not have adequate time for that vaccine to take effect.
Okay, great. Victoria, I hope that answered your question. And we have... Okay, thanks again, Victoria. We have, I believe, Vicky from Paris. Did I hear that correctly?
Correct.
And a little doggy in the background, too, I sense.
Yes, I'm sorry about that.
That's okay. Go ahead with your question.
When does the common cold or flu turn into the bacterial form of bronchitis?
Okay, so Dr. Salinas, some people get over their illnesses quickly, no problems, no complication. Others seem to have it progress into something more serious. How can you assess when it is turning into something more serious, and who is it more likely to happen to?
Okay, actually, you're getting two separate infections. One, the viral infection comes in, the cold, if you will, and your body starts reacting to that. Sometimes, if your body's defenses are very low, then you can get a super infection with a bacterial component. in which case you're going to need antibiotics. Usually, as we said before, if you run a high temperature above 102 for more than 3 days, or 104 temperature for more than 3 or 4 hours, you should probably be seen by your physician just to make sure there's not a bacterial component to the symptoms you're having.
So high fever is definitely a huge symptom to watch for if it's converting maybe into something more serious, or if your immunity's been knocked down and you're now catching some other disease.
Correct. High persistent fever.
Okay. I hope that answered your question, Vicki. And while we're on the subject, a lot of people who develop colds seem to progress to sinusitis. That seems to be one of the kickers, and everybody seems to want to have an antibiotic. They want it up front. They know this cold's going to turn into sinusitis. Who does it normally happen to, and what are some maybe preventive measurements people can take so that that doesn't happen?
Well, first of all, if it's the cold, you're going to get a lot of nasal congestion and head stuffiness, sore throat, and that's part of the way you know that it's a cold. Whereas if you run a high fever, in addition to the body aches, muscle aches, and a very large headache, you could suspect more likely that it's the flu. So if you want to protect against sinus congestion, there are several things you can do. You can run a cool mist humidifier in your room.
Okay.
There have been some studies to suggest that you can actually drink chicken soup, which increases the nasal ciliary. Those are little hair cells inside your nose that help to move germs and secretions out.
And there are so many grandmothers who love to claim that that is the truth.
If you don't have any underlying medical conditions, your common cold should run its course in 4 to 5 days and be gone. You're going to have a few days of the nasal congestion, and you can use some over-the-counter products if you like.
And we'll get into that, actually. I'm sure another question will lead us into that. We covered that before, Rosie, so I'm going to run through that second part of the question quickly. The cold is usually milder symptoms, stuffy nose, maybe a little bit of a sore throat. But the flu really usually has a fever, shaking, chills, possibly achiness. You feel very fatigued. You feel very run down. Now, once again, population for the flu shot, because we really want to get this message out tonight. Older people, not necessarily just nursing home people, but individuals who are older. These are the people that are more likely to become the statistic we hear about, 20,000 Americans a year dying from the flu. Dr. Simon, who needs to take the flu shot?
The Centers for Disease Control, who tells us who should take the flu shot, specifically states that people who are 65 years of age or older definitely should get the flu shot. The second category are those 50 to 64. They would recommend to get it because if they do get the flu, they're more likely to get side effects. And again, we want to keep people from dying from the flu. When the flu comes around and 20,000 people die, that is just absolutely horrible. And it's mostly preventable, except in people with underlying conditions. Okay. Additionally, anybody with an underlying medical problem, whether you have types of cancers, HIV, heart failure, diabetes, all those people should be getting it.
People.
Yes, absolutely, definitely. And in children, the same rules apply for getting the flu shot as well. We give a smaller dose in children who are very young and haven't had the flu shot before, not the full adult dose also.
Okay, I hope that answers your question. Now, my tips of the day. Unless you have an egg allergy or you've had a reaction to the flu vaccine, there is no reason not to take the flu vaccine. Go ahead and take the flu vaccine. The flu usually presents with an onset of fever, chills, sore aching muscles. You may have generalized weakness. You may have a headache. Certainly you can have a sore throat and a cough. The common cold has much milder symptoms. Now, cold symptoms can be helped with a variety of over-the-counter preparations like we mentioned, but it may still persist for a week. Certainly, washing your hands is the single most effective way to prevent the spread of these viruses. Do seek medical attention if symptoms get worse or if they persist beyond a reasonable amount of time. Don't take leftover antibiotics. Don't self-medicate. For more information, log on to www.kvcr.org. My thanks to our guest this evening. Next week, we're talking about antibiotics, not always for what ails you. For Doctors on Call, I'm Amy Hendel. See you next time.